Tell me what you see when you look at me. Do you see another brother lost in these streets looking for his soul?
Trying to find my soul.
Or do you see another brother searching for lost souls in these streets? A street soldier.
Street soldier.
Here to help you get that chip off your shoulder, warm your colder days and sober your drunken ways, and find a way to help you get over these hurdles placed in our path. And this is not meant to amuse you. This is for all those who have questions but are afraid to ask.
I won't be afraid. I won't be afraid. No. When times get hard, you lose your way. Open your mind and hear what I say.
This is a message for the hard and the soft. To those who tune in weekly and to those who keep an eye out for 8 p.m. on Sundays and turn their radios off. The truth hurts. The cloth has been pulled. We're walking around half dead. Use this show as your IV. Alive and free is a new movement. We've achieved self-destruction. A street soldier promotes self-improvement.
Streets couldn't be no colder, so I gotta be a soldier. It shouldn't be this hard for me. Even when it seems so hopeless, I gotta keep my focus. I'm glad to be alive and free, yeah. Streets couldn't be no colder, so I gotta be a soldier. It shouldn't be this hard for me. Even when it seems so hopeless, I gotta keep my focus. I'm glad to be alive and free, yeah.
Hey Doc, how you doing?
How you guys doing this evening? Can you hear me okay?
Yes,
Hear
we
you
can.
loud
Good to
and
see you.
clear, and thank you once again, man. Look, you got a job, brother. You talking about. See, we alive and free. You alive. and look, I gotta say this real quick because I just got a text. I gotta say it before we get there. I gotta give a shout out to my sister, Donna Marshall, who was watching in Seattle, and she's watching from Seattle. And she said, tell Ann to send me a copy of the annual report. She said, she called me Jojo. Jojo, can you send me a report? Yes, and she sent me a question too. So we got a bunch of questions. Doc, let me just say, I mean, I love you, but we got to stop meeting them like this.
Well, at least under different circumstances.
Well, that's what I mean.
Meeting like this is always good for me, but under these circumstances, let's make them different.
Well, but yeah, and you know how you only see people, you see them at the funerals, and you say we gotta go to somewhere, we gotta go to a party or something like this. But this is what we're in. And we were talking at the beginning about it's been about a year and 8 months now. I think it might have been early, but we go back to January where this thing came upon us, and it's been a real fight. And for you, a medical person, who has taken an oath to save people's lives, this is probably, been your worst nightmare, and you're already in the business of saving lives. I tell people all the time, this is the guy, when the brothers get shot out on the street, he's the one, when they come to Zuckerberg, he's the one that stitches them up. So he's in the emergency room all the time, and this must seem like one long emergency room for you. So thanks again. I got a lot of feedback from the show. I think there's a bunch of people watching. Everybody wants information. I got a laundry list of questions we're going to try and go through. And I sort of scripted this thing out, Doc, so just be patient with me. I had so many questions, I had to break them into, subject areas, right? So okay. I'm going to do my best to do that. There's a couple things I want to plunge into immediately, but I'm going to start with just a couple of articles I found. And by the way, man, I know you read this stuff every day. I was just reading today to try and catch up on stuff. There's a ton of stuff, but a couple of articles caught my eye. And I'm actually going to call this a tale of two states. And I was just fascinated by the polar opposites of these two states. And one is Arkansas and one is Vermont. And the title of the Vermont one says, I don't feel any fear of going out. And it talks about all these people going out and dancing and going to the,
That's right.
going to the store and just having a grand old time, almost as if this thing wasn't here. And then there is a story of Arkansas, and I'm gonna read you a little bit of the most shocking thing. Lady, listen to this, lady Ian Ann. This weekend, 80,000 doses of COVID vaccine will expire in Arkansas. Right. There simply weren't enough people in the state willing to take it, even though cases and deaths from the Delta variant are rising there at an alarming rate. And here's a couple of medical professionals, which I'm sure you, as I say, you will feel this. Prior to the vaccine, I was heartsick because people died and we couldn't help them. Now they don't get the vaccine and we can't help them. And so after every death, I go back to the pharmacy and I cry. Then I go back to work. And Dr. Jose Romero, who's the health secretary for Arkansas, said, "I'm angry, upset, disappointed. As a nation, and we worked so hard to get this vaccine out. And not to have them accepted by the public is difficult to understand and accept." Anyway, the main difference between the two states, I mean, on paper, is that Vermont's vaccine rate, this lady, is 83.7%. And Arkansas vaccination rate is 36%. Is it that simple in those two states that's why that I said Vermont says it has the lowest number of deaths in the United States and one of the lowest infection rates, and Arkansas is on the rise? Is it that open and shut when it comes to those two states?
So it's just great being on with you guys. It's just wonderful seeing Lady Estella Ann and everyone. Thank you for having me on again. I'll just start there. It's been overall, I think, exhausting for regular people, and it's been exhausting for healthcare professionals because right now the people are dying preventable deaths, right? So preventable deaths in medicine is described as a death that we can prevent using the tools we have. The tools we have is the vaccine. So if Arkansas had 83 or 90% vaccine rate like Vermont, it would be normal living there. Instead of what's going to happen now is there's just going to be death and destruction, which is really terrible because this whole vaccine thing has been politicized. So Vermont, everybody did what they had to do to kind of back to normal. I did see that article about folks dancing and having a good time and going down, just doing everything regular. Whereas in Arkansas, they're doing things regular, but they're basically spreading the virus amongst each other. Now, the Delta variant is the thing that everybody's all up in arms about now because it changes the game from the Alpha variant. The Alpha variant, the vaccine was sort of developed on that, and these viruses, they mutate, and the more they mutate, freely in their population. So in Arkansas, it has the perfect medium, which is people who are all together to mutate. I mean, and even in other places, I saw this thing, Lollapalooza is this weekend in Chicago. And I was just like, I looked at that and I was just like, what a setup for a super spreader event, because what happens is the whole business has really changed, and the CDC is now gone back to recommending masking again. And I know everybody's all confused about it, and we'll get to that later on, but it is simply this, we need to get more vaccines and arms in Arkansas so that people won't get sick, because eventually what's going to happen is the system is going to be overwhelmed and there's not going to be enough places to take care of people, much like what happened in New York, where that's why they had so much deaths. I mean, they had deaths, there would be places that I know people were in where they had 30 deaths a day, but people just dying before they get to the hospital. The ambulances were going all night long. It was just a total mess right there. So more vaccine, better people do. Obviously, healthcare workers are in some ways beaten down, but our job is to take care of people when they come in sick, and we'll do what we have to do it. But even in San Francisco, the numbers are going up. We had one day where we had no admissions in the hospital, and everybody was celebrating it at San Francisco General. And then now the number is about 15 or so people in the hospital. The highest we had gotten to at one point was 70, and the numbers are kind of creeping up. And it's mainly people who are unvaccinated who are experiencing the brunt of things now, although there's a small percentage of people who are doubly vaccinated who have been exposed to the virus who do get the illness and can spread it. Remember, the vaccines are 95% effective 90% effective. So that means that 10% of people, or 10% of folks, will have something. So it is complicated, gets more and more complicated. And we're learning about it every day. So I think that's the way you got to look at it.
And you went to I got a list. I broke it down. Most of the questions, you probably have to, repeat a couple things.
Oh, that's okay. I'm happy to do that.
Yeah, only because, and I'll get to this later. The biggest question I had out of all the 40 responses I got, the question, well, what is the Delta variant? Where did it come from? And I mean, what do you know about it that you can share with folks?
So what happens is very early on in the pandemic, they basically marked out the sequencing of the virus, right? So it means that, okay, well, what does the virus look like? So it very much like identifying a person. We identify people basically where they look. In the lab, what they do is identify the virus. So the virus, the alpha variant, the first one, basically looked this way. Now what happens is the Delta variant is a double mutation. That means that it doesn't look like something else, and there's a double mutation, one there, so in two places, and it's the one that kind of went through India and killed all those people in India, right? So that one, it's way more contagious. So instead of getting 1 or 2 people in a family, it gets 8, right? The virus particles are really multiplied in huge numbers. So instead of having a couple hundred, it may have thousands. Right. And you have to be in contact with people for a shorter period of time. So it is way more scary than the other variant because it gets to people faster and it can make them sick. Right. So, but it is mainly a problem if you're unvaccinated. If you are vaccinated, if you get it, you'll have a mild case of it. Right. And they call it breakthrough cases, and maybe like a cold. But in general, some people do go to the hospital. But rarely is there a bad outcome with it. So the bottom line is the vaccines protect you even against this Delta variant. And there's going to be more variants because the more it mutates. I mean, the viruses are built to mutate. I mean, that's how they live, right? They just like, oh, I'm gonna get in there, I'm gonna have a field day, right? So they're going to have a party when people don't have the vaccine. They're having a party. They're like, oh, we're gonna change things around, and we're gonna have a Delta, and there'll be an Epsilon, there'll be an F variant, there'll be a G variant. There's just going to be more and more variants developing.
Go right through the whole Greek alphabet, huh?
That's right. It'll keep going down the road. This is just the newest one that's out there. And that's why eventually you're going to, at some point, have to have a booster like we do for when you take the flu vaccine. It's going to be the same kind of thing. They are working on a vaccine that will knock out the whole family of these SARS-CoV-2, and there'll be a 3 and a 4 and all that. So it just is a way to categorize it. Not complicated. It's the same virus, but it's just more vicious.
I guess in my conversations with people, it's just they expect the virus to be logical. Like when you made a great statement. That's what viruses do. We mutate. So it's like they're asking, why are you mutating? I mean,
that's how you survive. You're a virus, right?
That's a very good point. That's excellent. Viruses are doing what it has to do to survive. I'm not sure we're doing what we have to do to survive.
Clearly not.
We're kind of a mess, We're a mess. We're better in San Francisco.
Oh no, it's frozen.
Oh, is he frozen?
Yes.
It ain't us this time, huh?
No.
Okay, ladies, I may need you to sing.
I'm not
during this commercial break. No, but have you, while he's coming back on, Doc is probably gonna text me and let me know that he's frozen, or let me text him and say you're frozen. I'm sure he knows it.
Those photos from Lollapalooza in Chicago was the scariest thing I've seen. And I was watching scary movies this weekend, So, it was just like a huge concert with nobody's mask. Everyone's close together. There's definitely no social distancing. That was scary. And I think about like the students going to the university in like a month, and then like my family who's an hour away from Chicago, and then what do you like, how does that all
Well, that's
I was at the grocery store today in Menlo Park, Atherton Menlo Park. And I had on my double mask. Okay. Half of the people in the store did not have on a mask. And there was no one saying, I mean, all the people who worked there behind the counters, working with food and doing the cash registers, they were masked. But the people that were shopping did not have on masks. I was absolutely, first of all, I was so appalled. I never would, usually I just kind of cruise through. It's Draeger's. Draeger's is one of my favorite places. They have one of the best little bakeries, you know, where I get my little cookies. Any rate, and I just kind of cruised through Draeger's. Today, when I saw, I thought, let me hurry up and get out of here. I was out of there so fast. It's like the faster trip I ever made through Draeger's because people weren't wearing masks and they were talking to one another. And, you know, it's like.
Well, but see, Mrs. Stella, a lot of that is due to the confusion around, you know, we were told we could wear masks. So right. And that's why.
See, to me, this confusion is another excuse for refusing to use your common sense.
I'm not gonna. That's why I got the doctor. I got the doctor to tell us what to do, right? Because we were told one thing, and then we're being told that. And my point is, the virus should determine what we should be doing, right? The virus should determine the latest guidelines, the next set of guidelines, the next set of guidelines, the next set of guidelines. Now, you know, if people don't necessarily, and that's a whole nother thing we're going to get to, but.
Well, the numbers, even the numbers of that little video that Ann showed, the numbers in California, you know, they were, even though we're doing good, it's still a lot, it's still a lot of people.
You got it. I got it. I know. Look, that's why we got him here, to be the voice of medical calm, medical reason in all of this, because everybody is.
Yeah, I'm back here. There I am.
Oh,
yeah, so
thank you, sir. Thank
No
you, sir.
worries.
Can you hear me?
Yes, we can hear you. And we understand how the internet Wi-Fi works. So it's not a problem. We were just processing.
Yeah, I don't know. You know, my computer was doing okay, but I'm going to try to reboot it, and then. But in the meantime, I'll do that. But I could not believe that, like, in the middle of everything, you know, I'm like all ready to go. You know, I'm answering your questions. I'm all set up, and then all of a sudden, here it goes. Right? You know.
So this is what I heard you say, Doc. Back to that Delta variant. It's way more contagious. This strain or variant is more contagious than the original one. The virus is mutating, and then we're probably going down the line. Just so folks know, you know, survive. That's what a virus does. A question I got was, and I've heard 90 percentages, and some people want 100%. And I've told people, you know, as far as I know, you're not gonna get 100% probably with any. I mean, I don't know if American medicine in any way can give you 100%. But a lot of the questions were about, does the COVID shot, does the vaccine protect against the Delta variant also? That was a question that came through from a lot of people. What's your take on that?
Yeah, the data shows for that is that it is about 85% protective, 90%. So it's actually pretty good too. So that I think everybody was worried about that, right? So I think it's pretty protective. I'm just working on trying to get my computer to work. So it is just as protective, and you're actually in a good space, you know, with it. So I wouldn't worry.
Oh, I thought he went away again.
No, he's working. So I'm just wondering, with the Moderna and the Pfizer, if there's one is more protective than the other?
Well, I think that what my understanding is that they're just as protective,
Okay.
both of them. The Johnson & Johnson is not as protective, although against the Delta variant, all three of them have actually done pretty well in the studies. So I think that the main thing is to get one of them, the one that are more readily available with Pfizer and Moderna, but they do help you and they save your life, which is kind of what you want to have. You want to have something that's going to save your life, and I think that has been the main thing, is that getting people to get the shot is the big deal, right? We got to get people to get the shot.
You know, and I guess an unintended consequence, but it's a good thing, is that a lot of these states where the Delta variant is surging, now people are getting it, because I mean, I saw a place where there's an article in the New York Times, or one of them, it says there is a rush in a lot of places now to get the shot because of the presence of the Delta variant. And she says, my friend works at a hospital and she told me there's 18-year-olds on ventilators. That scared me. So she decided to get the shot, right? And this is a young person who just graduated from high school. Another person said she was skeptical, but to be ignorant is a different issue. My only regret is not doing it sooner. And they just quote a lot of people who were saying, I'm scared. And apparently for some people, being scared is enough to make them go get the vaccine. So in a sense, that's good. But, some of these people, I mean, it's not a logical thing. The one thing I found about this, doc, is not a logical thing. And facts and data only go so far with folks. And we're going to get to some of the reasons that they haven't taken it. But I am writing down what you say. The vaccines do protect, you said 85-90% against COVID and the Delta variant. And it doesn't mean you can't get it. And that was the other question. Some people are saying, well, you can still get it. And even in my conversation, my lip now said, yes, that's true. I'm a percentage guy. I'm going on percentages, right? You still can get 80% is better than 10%, for me.
No, I mean, nothing is perfect. I mean, I think everybody wants everything to be perfect, right? But it's not going to be perfect, right? And that's really what we got to understand, is that nothing is 100%. And you just want to get the vaccine that you get access to. I mean, you saw that article there where they're actually throwing out stuff now, right? Yeah. For that, right, which is really terrible. They're throwing out the vaccine because there's a place that a bunch of them expired, and that's the worst thing in the middle of pandemic that you can do is to throw out the vaccine in the middle of a pandemic as opposed to getting into somebody's arms.
What are the newest and latest mask guidelines now, and why? And of course this may change, but what is it as of yesterday or today? As far as what do you know about that? What are the guidelines?
So this is the guidelines. So what happened was there was a case in Provincetown, Massachusetts, that the CDC just analyzed. And what they did is when they analyzed it, I'm trying to come back in on my computer. So if that's okay, let me see if I can try it. Got it.
Gonna have to mute one of them.
Yeah, we know, because we got the echo.
Okay, let's see. Can you hear me now?
We can hear you.
Yeah, I'm working on there we go. Here we go. I'm back now. Yeah, so let's talk about the issue of
you said there was a case in they were looking at back east.
Yeah, so in Provincetown, Massachusetts, there was a outbreak in, and of course, yeah, there was an outbreak in. I'm getting an echo here. Let me see if I could just end this and then this and then recording. I'm trying to leave. Yeah, I've left. Okay, good. Now I'm back here. Can you hear me okay or not?
Yes, sir. We got you.
You can hear me?
Yes.
Good. Yeah, so in Provincetown, Massachusetts, there was an outbreak among vaccinated people. And what they found is that actually, because of what they did is in that outbreak study, they found that people who had the vaccine and were vaccinated got the infection milder, but they were actually able to spread it to other people. So the whole idea is that the amount of vaccine, the amount of virus that you have, right, that you can spread is still a lot, right? And even if you're vaccinated. And even though you got milder cases, and remember, this is a very small percentage of people. You're looking at 0.01%. So just like way less than 1%, right? Of people get it who have breakthrough infection. So everybody's focused on the breakthrough infection, but a very small percentage of people. So what happens is it means that, okay, if you are vaccinated, you may have a mild case, but then you can spread it to somebody who's vaccinated. So then it goes back to all the people who are not vaccinated because we're trying to protect them, right? So they're like, what can we do to protect them, right? So that's why the CDC then changes the whole thing, and it feels like mask on, mask off, we're doing stuff, but it's all related to the fact that people who are unvaccinated and they could get this Delta variant and they could get sick from it, right? So that's what it is. So that's why there's all these mandates. I mean, as far as I'm concerned, this is mandated. Employers should mandate. UC, University of California has mandated for everyone. The city and county of San Francisco is talking about mandating. Employers are starting to mandate it, for you to come to work, right? I mean, the Houston Methodists down in Houston, they were the first one to do that. And they said, okay, you want to work here, right? You got to be vaccinated. And the truth be told, if you're a healthcare worker, you should be vaccinated because you're going to spread the virus to somebody and hurt them. Right. I mean, that doesn't make any sense to me, right? So I think we gotta get more people vaccinated, and that's why the mask thing has got confusing, because they were like, okay, if you knew everyone with you were vaccinated, then that would be different. But the problem is you don't know, and the honor system doesn't work because people are falsifying things. They're saying they got it, they didn't get it, and what have you. So that's what the mask confusion is about. So we could talk about schools later on, or we could talk about it now. But I mean, in order to open up schools safely, they're going to have to put everybody in a mask, right? Because the kids less than 12 cannot be vaccinated, right now, because the data has not come back in. It'll probably come back in. First they said September, then they said October, maybe December. They're going to have to figure out when it's going to be safe to give it to the kids who are under 12. So 2 to 12, they're working on it. When they do that, then they can do a mass vaccination among kids, assuming the parents will allow us to do that. And the parents in some places are totally against it. I mean, people talk about you getting like things, you become magnetic because you got the vaccine, or somebody's trying to put like a implant an electrode in you where they could trace your stuff. See, there's a war of misinformation that's coming out all over the place. And people, they read something, they think they become an expert, and then they just like, okay, I'm not going to do that. And the problem is that that's just bad for public health. Public health means that's it. Everybody's got to get vaccinated. Right?
I have that list that I was going to come to you with as we near the end of the beliefs that the vaccines shots can cause. I'm going to come back, but let me go back to on the mask. We have been told before that vaccinated people, or recently, that vaccinated people, if you were outside,
yes,
you didn't have to wear a mask. Are they saying, where are we on that? And then I'll go to inside, indoors, in stores.
So the easy one is inside, right? Inside, too many people, not enough circulation, you got to wear a mask. Okay. So outside is where you probably could get away without doing it, although I just wear it everywhere now. But outside, it's probably safe because you can move around and there's enough space between people. But outside, and I mean, it's all about like the amount of people in the area, right? So let's say you're at Lollapalooza in Chicago and there's 100,000 people on top of you, right? Like that's not a safe environment, right? Because the virus loves that, right? They love the music, but it also loves people like in close spaces. So that's a bad thing. And if you're out there walking by yourself, if there's a small number of people, probably not a big deal. But inside, you should certainly mask. You got to mask because the problem is that it's an aerosol spread thing, and if you're close to somebody, you got to do it. Now, they had recommended in small groups, everybody's vaccinated, then they increase that from 12 to 20 to maybe 30 or 40 folks, in an area that people are all vaccinated. It's probably safe, in that situation. But it's all about density and stuff. That's if everybody's vaccinated. But the thing is that there's still breakthrough cases. So the safe thing to do is mask everybody, and that's why they went back to masking everybody inside, right, with stuff. So the inside is easy. Outside, there's better circulation. As long as you're not in a crowded place, you're probably okay.
It's funny. You said I could see the virus just looking at that big crowd back there and saying, just what I've been waiting for.
They're getting there, they're going to have a super spreader event there.
Obviously this is a science fiction movie in my head, but the virus is saying, I've been looking for a crowd like this. I'm flying around, doing my thing. And, there's only 10 people here. I ain't got much chance. But over there, I got plenty of chance. And people got to think like the virus thinks. That's what
I think that's what you got to say. I mean, it's spread by aerosol. So that's when, people yelling, screaming, that means that it's going to spread. And that's where the dangerous thing is, so it's all about amount of circulation of the air and number of people and density of people in the area that you're in. That's really what it's about.
This might surprise you, but I got a lot of questions. And a lot of these are from young people who are now pondering, getting the vaccine. And they were asking, the effectiveness of the COVID shot, of the vaccine. Should I get it? And which one? Does it work against the variant? And which would you talk about? But one young person says, what do you think of the long-term effects of the vaccine? Also, I'm planning to take the vaccine. Which one is better? Somebody else, and this was actually an adult who's not vaccinated, asked, should we get the vaccine? And if so, which one? Another person asks, are there certain vaccines that work better to counter the new Delta strain? Someone else said, what is the likelihood of someone who's been vaccinated getting the COVID or the variant who's been vaccinated? I think you've talked about that.
Yep.
Here's another. And I'm really focusing on these young people. He said, what are the percentages of effectiveness? Why are the percentages of effectiveness dropping? So I didn't know if that was true, but he somehow in his the effectiveness. What are the risks to a 19-year-old having heard issues with the vaccine? Are there any long-term side effects that we should know about? And I know both of these young people are thinking about doing it. They're asking that question. So if you do what you can to say about.
So those are good questions. So let's talk about the first thing is that when it first struck, it was in nursing homes and it was older people over 65. That's the number. And a lot of people got sick, right, and died from it. So what has happened is the new variant is attacking people from 20 to 40. So that's exactly the group that we got to target now, including healthcare workers. I mean, I was reading something today that there's something like 20 or 30% of people working nursing homes haven't been vaccinated. I mean, that's the most ridiculous thing that I've ever heard about that if you work in a place where the virus grows, you got to do it. So for young people, let's go back to that 20 to 40, right? You got to get vaccinated because now that's what attacking. So if you get it, there's a certain percentage of people who get the long haul syndrome, right? Where they basically, they feel weak, they got brain fog, they got real problem, right? So now we have given the vaccine to 325 million people in the United States. There's been very few side effects associated with it, right? You'll hear about this, you hear about that, but that's fairly small numbers of people. You're talking about people that you can count on a couple of hands that may have some side effects, or the side effects are minimal. Right, the long-term effects we don't know, but we've been working with RNA vaccines like this for 5 years or more, and they've been given safely, and there's been no major problems. In the studies, no major things have been. In younger people, there's been some things about heart inflammation, but they were reporting 25 cases. If you give something to 325 million people and you have 25 cases of something, that's nothing. Right, that means the risk of getting the virus, right, outweighs the risk of the side effects. So you should get the shot. Now, which one you get? You get the one you can get your hands on, right? So the ones that have been more readily available are Pfizer and Moderna. You take 2 shots. Now, remember, it takes 2 shots, 3 weeks apart, and 2 weeks after you get the second shot, you are fully vaccinated. right? So it's going to be a 6-week cycle or so, right? Or 6 to 8 week cycle where you basically take the shot. Like I took my first shot in December, second one was in January, right? And so at the beginning of February or so, that's when I was considered fully vaccinated, right? So if you take J&J, you take the 1-shot deal, you're fully vaccinated 2 weeks after that. And that's when your body's at maximal defenses against it. And what they're debating is how long does your body make the antibodies to the virus right afterwards. And that's why they're talking about the booster, because it may wane over a period of time, because now we're getting now 8 months after people have taken it, and they're trying to sort of figure out what the timing that's going to be. But I think at some point they can do it. The thing that the FDA can do, and they're working on this, the FDA can give full approval to the companies for the vaccine, right? They can actually do that. They're working on that. And hopefully by September, instead of having an emergency use authorization, right, they will have full approval. And that will maybe bring even more people in, because we got to get more people into the fold. The interesting thing about who is scared to take it, who is vaccine hesitant, is that, yeah, it does happen in a lot of groups. It happens in Latino folks. It happens in folks who are African-American, but that number is like something like 10 or 12%. And if you talk to people and you let them know, like, listen, it's okay to worry about this thing. It's normal, but it's safe, right? Nothing's going to happen to you. And this is taking the vaccine is far better than getting the COVID infection, because the COVID infection is just terrible. So if you talk to folks in general, people of color, right, then people basically, they come around and they understand that they should take it. And if you listen to them, they'll do it. But the most hardcore people who are never going to take it are, unfortunately, who you think, right? It's sort of middle-aged white men who tend to be right-leaning. They basically, I'm not going to take it. I mean, I saw something that really blew my mind. I saw a guy, he was in the ICU for 3 weeks, and he's going home, and he said, will you take the COVID vaccine? They said, no, I'm not going to make anybody, I'm going to make no government force me to put this thing in my arm. And I was like, you just almost died, right? Most people basically are begging for the virus when they come in and they're dying. They're begging for the vaccine, right? And they're dying from the virus, right? And they can't get it then because it's too late, right? And this guy, he could get it when he recovers, because if you recover, 2 months later, you can get the vaccine. But he's like, no, I'm not going to have anybody force me. Now that to me is really bad. And that's all politically motivated. It's not based on anything in public health, because you want to make sure people, right, take the vaccine, right, and they understand it's safe, right? So people need to stand up and say, take the vaccine, and not make this all political and politicizing all this stuff. This is where we've kind of fell down.
So I wonder if we could talk about the long haulers and those who have had COVID, like the man who had it, left the hospital, and he was eligible to take the vaccine. Some people believe, I've already had COVID, so I should have the antibodies built up. Why should I take the vaccine? Or is that so if you could talk about that, what causes long haulers, and and then more about the booster.
Or people who've had it.
Yeah, so if you had it,
question for somebody had it, and should he still take the vaccine anyway? Yeah.
So if you had it, there's some level of immunity that you do have, right? But the problem is it's not enough, and it doesn't work like the vaccine. The vaccine gives you a super level of immunity, and that's really what you want to have. So having it is not good enough, because you can get it again. And there are people who got it twice and they died.
There are people who've had it more than that. That's right.
And you had it. So that's the thing. So you get COVID, you recover for 2 months, and then they can actually give you the vaccine, and then you become immune, and your immunity is much better, right? Including against the variants and natural immunity. So the answer is it's not good enough. You have some immunity, but it's not good enough. And you need to make sure that you're immune for this thing, because you don't want to get this to any parts of this thing. So what is long hauler syndrome? So what they started to notice at the beginning, and you may have seen that written up, and it was also in, I saw something on 60 Minutes about it, is that they started to notice that people have weakness, the musculoskeletal, so they're not strong as it used to be. The brain is not clear. Men may have other, sort of, I mean, I saw something today was interesting, is that this was a rehab medicine doctor saying that the sexual potency of men may be affected by the virus. And they were saying, well, maybe that can help people get more men get the shot if that happened, right. But more than that, the brain fog, the confusion, all these
Don't
other.
tell men that.
No. If you forget, that's if you get COVID, right? That's if you get COVID, right? So, but the problem is we don't understand what the long haul syndrome is, and we're still trying to understand it. So the main things is there's weakness, there's respiratory breathing problems, there's musculoskeletal stuff, and there's other stuff that we're not sure about that goes along with it, right? So what we have to do is get people to get the vaccine, and you don't want to have the long haul syndrome, because there's young people having the long haul syndrome. They can't breathe. You want to go back to running, playing basketball, being active with your family, riding your bike, and you can't do that because you can't breathe, because your lungs are so scarred from this infection. So we know that it affects many organs, affects the lungs, it affects the kidneys, you get blood clots, you can get strokes, you can get all kinds of things associated with this. And you don't want to be in that group of long haul syndrome. So you don't want to get COVID, and that's why you need to take the vaccine.
Okay, thank you.
Bottom line, what I hear you saying, and I'm and these young people are actually watching. Should I get it? You're saying it's safe, get it. You're
Safe.
saying safe, get it. And you
Yep.
recommended one of the three, Moderna, Pfizer, or J&J. So to answer to this question, which one is better? They're all good. We're not sure of the long-term effects because it hasn't been here that long, but we're saying it all the time. And let's see, it does protect against the Delta variant. That's what I heard you say. And the percentages I heard you use were 85, 90, 95%, 80, and I think these are the numbers you use. I don't want to put those. That's what I heard, and if I didn't hear correctly,
That's
please,
right. That's right.
please put that out.
It's above 90%,
Yeah.
across the board. So I think you got to. Some people say 95%, so, but I'll give you 90 to 95%. That's 9 out of 10. That's pretty good. That's pretty damn good. That is really good, because some of the flu vaccines only work 55 or 60% of the time. For them to
Wow.
get this thing, the
Wow,
first shot, right, it's pretty remarkable.
Wow. Okay. 55% flu, 90%. That's I didn't know that. See, that's why we got you here, so we can hear these things. No decision has been made about a booster yet. I heard you talk about that, but and again, it's such a tough thing because this is new and you're finding out about it all the time, right? You got to have data to produce what's going to happen next. But there have been no decisions about a booster. Is that what I heard you say? But there's a good
There's
possibility.
been no decisions about it. They're still thinking about it. They're not sure, right, about it. But I think that you're probably going to end up taking a booster. Everybody's going to take a booster. And I think you might as well get ready for that. But it's just my speculation about it. It's not the actual what they're saying right now, right? So, they came out with this big announcement a couple of weeks ago. They were asking for that, but rather than ask for a booster, I think we should just ask. We should ask for full approval from the FDA, right? Get that out so that everybody can.
Why hasn't the FDA approved it? Is that because it takes a long time? Yeah, that was the next thing on my list. FDA
Yeah, it
approval.
takes. What happens is the process, the regulatory process that the FDA, Food and Drug Administration, uses is very long and cumbersome, right? So what they do is they create something and they get emergency use authorization for it. And when they get emergency use authorization from it, that's when it goes into practice and you get to use it, right? But if they get full approval, right, then it means that there's no issues. But it just takes time for that to happen. I mean, they got approval in November, December, and it's got to work its way through the process of doing things. And they have to look at all the records of safety and all that stuff. And each one has to be done differently. So Pfizer has to do it, Moderna has to do it, J&J has to do it. So they have to all go through the whole process.
Thank you, sir. Thank you. Someone asked a question about the possibility of mandatory vaccinations. In fact, they said, do you feel mandatory vaccinations across the board, federal, local employment and sports is on the horizon. How do you feel about as
I
a
think we tried the voluntary way of doing it. So I'm thinking more recently that the mandating is going to have to be the way to go. The federal government is going to do it. The military should do it. I mean, the private companies should do it. That way we can, because, it used to be that you could, with the first variants, you can get to 70% and maybe get this magical herd immunity where a lot of people have gotten it. But it may have to even be higher than that now with the Delta variant because it's so infectious, right? So we gotta boost the number of people vaccinated, because I think it's mid 55% that we kind of ran into 56%, somewhere like that, that people are fully vaccinated. So we've got to get more people vaccinated.
But that's going to be a hurdle. That's going to be a hurdle. No, because again, I keep thinking about this virus looking down at us and saying, look, I don't care. Boz is saying, look, I don't care about the politics. I just want to infect you. I don't care about your ethnicity. I just want to infect you. I'm doing what a virus does. I want to mutate and get you. And we got all these other things that we're dealing with that I'm sure the virus is just, the virus would probably be really upset if we just like, okay, forget all that. Let's get you. Let's get you and protect ourselves.
We have eliminated smallpox from the world, right? Smallpox was a terrible infection. It was really bad, and there was a vaccine developed, and everybody got it, and we got rid of it. And we got rid of polio. We've gotten rid of the things that we've developed vaccines for. It's been very effective, and we're going to have the other problem is that we're having issues politically in the United States and public health wise. What's going on in Florida is like absolutely bonkers. 20% of the cases in the United States are from Florida, right? So, and I just went there because I had some family stuff, and nobody wears masks. It's like the thing ended, right? Nothing's going on, but 20% of the cases in the United States are coming from Florida. The governor said you can't mandate masks. You can't do public health things. There's all these things you can't do. That's like totally absurd. They're at war with the public health officials down there because the public health official says, in order to be safe, you got to wear masks. They're like, well, you can't mandate masks. That's ridiculous. To do that. So that's part of the problem. The governors, don't want to go with the public health officials with stuff. So that's really what part of the problem is. And
this seems to be unprecedented because I do remember, I'm old enough to remember the polio cubes, the little sugar cubes I had to take, and all the immunizations I had to take just to go to school. In fact, I couldn't go to school if I didn't have certain immunizations. Something about this, for whatever reason, is not being taken through, through the health lens, and whether it be, fear of government, there's a whole bunch of reasons people have their own. It's being treated very differently. And to me, the only winner is the virus, but that's a whole, and the loser is us, but that's me.
Yeah, right. About that.
let me share with you now and listen to some of these. And this is still some of the things or beliefs that the vaccines cause, the shots cause. So, and as I say this, understand, people actually believe this. And that's why I'm saying they actually do believe it. Why they believe it, I don't know. I don't know. It can make you magnetic.
That's absolutely wrong.
And wait a minute. So what is in a woman? I think it was in Arkansas. Somewhere went in, and and the woman actually believed it can make her magnetic, right?
Yep.
And so what the healthcare worker did was got a magnet and put it on her skin. She actually did this, put it on her skin, and the magnet didn't stick. So she said, "Oh, I guess it doesn't make me magnetic. I'll get the shot." It was that simple for her. This belief that she had that it would make it magnetic was able to be disproved on the spot by the healthcare worker.
Yeah, that's more misinformation because the internet is full of misinformation. That is wrong, 100% wrong. It does not make you magnetic.
It's right. I know that, but they don't know that. Therefore,
people believe that, and you have to tell them. You got to try to educate them. Say, I know you read that, but that is not true, right? So I think we have to sort of say, you have to listen to the people who are in the know, because the worst part about it is there's actually doctors who are actually spreading this misinformation on the internet. I mean, that's a problem because we're supposed to be a trusted source, and there's some people who are not trusted sources. And I think we need to police some of that misinformation, because that's a big problem.
It's a bioweapon. That one I've heard before. The whole virus thing is a biological weapon, and I don't even know what this. Some of these things I don't know what to say about it. Except some people ask around saying it's a biological.
Again, that's absolutely not true, right? So it has people they look at these science fiction movies too much, and that is not. It's not science fiction. remember that there's actually a Black woman who helped develop this virus, the Moderna vaccine, right? Dr. Kizzy, I've forgotten Kizzy May's last name, but she helped develop it. I mean, this is through years of research that people that came up with these vaccines, right? So they're scientifically proven. They don't cause any mutations. The other thing that's been out, there's been things about people worried if they want to get pregnant, right?
That is the next one, and I've heard this a lot from young people.
Yeah, it does not affect your fertility, and you could still have babies and you're fine, right? So that's the thing. And they're recommending in pregnant women too. So there's no effect in pregnant women.
So it does not affect, there's no evidence that it affects fertility.
No, it does not. It does not.
Any, and so I'm just wondering if people want to believe it, just to believe it in the spot in face of no evidence. So you just said there's no evidence.
There's no evidence for that.
That I haven't heard the evidence. I haven't seen the evidence. I've just heard people are saying, all right, okay.
Yeah, so Kizzy May Corbett, that's right. Thank you. Kizzy Corbett, that's her name. Sorry about that. I keep forgetting her last name. She's pretty amazing. She actually just left the NIH to go somewhere else. She's now at a new institution. So she's amazing.
Let me give you this next one. It alters your DNA. It can alter your DNA.
No, it is an RNA virus, and it has nothing to do with your DNA. It's sent in as a vehicle into your body, right? And it basically tricks your body into saying that they saw the infection. So when you actually really see the infection, right, it responds. But it has nothing to do with your DNA. These are RNA viruses. They don't do anything. It does not do anything to your DNA.
We'll cross that one off. It puts microchips in you to track. I'm telling you, this is people.
No, I'm laughing, but it's a real thing because I've heard
people believe this.
People believe it. And we got to say, it does not put microchips inside of your body so you could be traced right by the federal government. That does not happen, right? It's not. It's just it's a drug. It's a medication that's given in your arm, right, to help your body. It sort of tricks you. The way all these vaccines work is it tricks your body into saying, a part of the protein, so that when your body's immune system sort of really gets exposed to it, it gets revved up and it just fights it off. And that's really, it helps your body work better. I mean, that's really, it has nothing to do with your DNA, and it just sort of goes away after a period of time, the actual drug that's inside your body.
Someone asked, is there a form of the virus in the vaccine?
No, it is not. It is. They've created. It sort of has some protein in it. It has some lipid in it. It has some other stuff in there, but but the actual vaccine. I mean, that's actually a good question, because there are some things where they used to give an activated vaccine to people.
Right.
That's sort of part of the Salk and the Sabin stuff. But this is different, right? This was sort of an engineered vaccine from scratch.
When will vaccines be available to? And I've sort of seen this. I think it's available now to young people. What's the latest?
12 and up can get it. So 12 and up, you can get it safely. The 12 and up, first it was given to the higher risk people. It was given to people over 65. Who they were in the first list because that's who was dying from it. Then they gave it to healthcare workers, and then they opened it up to everybody else once it was plentiful, right? With doing that.
I had a very interesting question, and let me see if I can find this one. And I just got a text from Don Strand. He said, Dr. Campbell he's the Fauci of the Bay Area. I said, no, he's Dr. Campbell of the Bay Area. So this is a question I got. My 86-year-old mother-in-law had her second Pfizer vaccine. Her blood platelets, what's that word? Platelet, what?
Platelets.
Platelets. Sorry, thank you. Platelets dropped to a low of 39. A couple of weeks later, they returned to normal range. What in the vaccination could cause this to happen and why? And are there any long-term residual effects? So that's a specific example. I don't know.
So we're still cataloging the effects of the vaccine on people. The main thing is we were talking one time, I think last time I was on, Lady Estelle got it and got febrile and gets wiped out for a couple of days, and other folks get, you get feverish, you feel hot, you feel tired. I mean, that's really the more common things that people get. There are other things that happen, but we're still trying to sort that stuff out, right? Because it's still, I mean, there's still idiosyncratic stuff, because people may react to kind of what's the actual stuff that's in it, right? Other than the thing because the vaccine is just not the drug, it's other stuff that's in it, and it may be the stuff carrying it that people are reacting to. But what you got to do, I mean, there's a lot of reasons why your platelet count could go down. So I would first look at all the other things, because there's medications that do it. It's pretty common. I mean, I'm an ICU doctor, and I see people's platelet counts go down all the time, and it could be a lot of other reasons for it. It may not just be the drug, the vaccine. It could be other things that can cause the low platelets.
Here's a question asked about someone who's incarcerated. He said, can you ask Dr. Campbell, will your taste and smell ever come back? I have a good friend that lost his taste over 8 months ago, and the smell comes in and out. Will it ever come back? He's incarcerated, so he's pretty limited to over-the-counter medication. What can he do?
So what we do know is that if you get COVID, one of the first symptoms that you get is you can't taste, and you may not be able to smell. If you get the actual COVID infection, COVID-19 infection, you get the infection, that can happen. So what they're trying to do is figure out that all these people have long haul syndrome, because that's a long haul syndrome question, right? It's like, okay, your taste has gone away, will your taste come back, right? So my understanding is that the taste comes back, but it is kind of slow when it comes back. But we're still trying to understand what the long haul syndrome means.
Mm-hmm. Okay. And how long that haul is going to be.
That's right.
And it probably varies from person to person.
That's right. It does.
It probably has a lot to do with the chemical makeup of the individual.
That's right. Everybody's a little bit different. And some people, maybe a short period of time, they feel back to normal.
Sure.
People don't feel totally normal. I mean, you have, people who, there was an example of, there was actually one of the editors for the New York Times. I saw her on TV, and she got the infection, and she was a runner, and it took her 8 to 9 months for her to start running again, right? Because she couldn't get her breath, right? So there's still, we're still trying to work all this stuff out. So that's for the actual COVID infection, right? Yeah. None of that is associated with the vaccine. The vaccine, you do not have that effect from the vaccine. The vaccine is safe, doesn't affect any of these things that we're talking about. What we're talking about is the question from the gentleman is regarding the actual COVID-19 infection.
Here's an interesting question, and I wouldn't have thought. I actually like this question because he's thinking about. I got a question: Is global warming a factor in any of this when it comes to the virus? I just thought it was fascinating because
I don't. Well, I'm going to say I don't know that answer. Right. Okay. So global warming is linked to a lot of things, but I don't know the answer to that. I mean, they're still trying to figure out, what triggered this virus to sort of come. We had SARS-CoV-1, now SARS-CoV-2. They're still trying to debate, how it jumped from an animal to human in China and how people got infected with it. They're still debating all that stuff. So it's still kind of up in the air.
And are there any comments in the chat you want to read? And then I have a guest who'd like to personally ask Dr. Campbell some questions because she don't think I'm good enough. No, no. Any in the chat?
There are some questions. Let me turn this down.
That we haven't covered. I don't want to necessarily go over ground we've covered before, but Go
Yeah,
ahead.
just, once, if someone has COVID, but they weren't vaccinated, what's a good time frame that you'd recommend for them to wait before they even get vaccinated?
I think the waiting time is a little bit over 2 months that they've been recommending people to get vaccinated. So it's a little while because your system has to recover before that. So then you need to be checked out. You got to check in with your doctor. You can't, there's vaccination sites all over the place, but if you actually had the infection, you need to go to your doctor and talk to him or her about, what your condition is and whether or not you're okay to get it. All right. So you want to make sure you're safe. And people have been waiting about 2 or 3 months afterwards, something like that.
That's great. And then I guess some people may have gotten worse after they've gotten the vaccine. And so I don't know if that's because of the vaccine or what that might be.
If they had COVID and they got the vaccine?
Well, someone commented, they said that they're afraid to get the vaccine because of being a long hauler, because some have gotten worse after getting vaccinated.
So that's sort of something that we're still trying to work out. So that's why you need to talk to your doctor in consultation, right, about what's going on with that, because I've not read that people have gotten worse from their COVID symptoms. Now, the long haul thing is we're still trying to work that out. And the problem is there's very few clinics around the country that are taking care of people who are long haulers. So you'll go to your doctor and your doctor may not know what's going on, but they know you and they got information on you and they can look at your lab tests. They could talk to you and they could see what's going on. So I would advise that person to go and talk to the doctor, talk to them about their symptoms, right, and then kind of go from there. So they're still collecting information about what happens after you get. I mean, I took the vaccine 8 months ago, and they're still sending me stuff about how I'm doing after the vaccine. So they're still trying to collect information on that, right? So if you have somebody who's not feeling well and they've got the vaccine, that needs to be reported, right? Or so that we can kind of keep track of that. But they're collecting all that information already, so we should know exactly. So when that goes into the final authorization information, right? But so far we know that it was given to 325 million people, and there hasn't been. So let me just sort of say this. This is another rumor, is that nobody has died from getting the COVID vaccine, right? Period. Right? We have 613,000 people who have died from getting the COVID infection, right? That's a real number, right? So, that's creeping up on the number of people who have died during the Civil War in the United States. So that's a lot. So nobody has died from the vaccine, and 316,000 people have 613,000 people have died from getting COVID infection. Young, old. I mean, they're talking about newborns getting it now. I mean, so there's all kinds of ages of getting it. So.
And just one last comment from our chat room from Llewellyn, who is in South Africa. And he says, the vaccine saved me when my entire family tested positive a few weeks ago. And we hold Llewellyn dear to our heart. So I just wanted to share that it will save your life.
Yeah, thank you for sharing that, because that is certainly true. I mean, if you've been vaccinated and you have a breakthrough case, it's going to be more like a cold and not like the serious symptoms that it has. So the breakthrough cases are very, very small, way less than 1% of people who basically are getting infected. The majority of the people who are getting infected now and are dying are people unvaccinated. This is a pandemic of the unvaccinated right now. That is the message. We worry about all these other people that you hear about and people may know, but it's about the people unvaccinated. Those are the ones getting sick, going to the hospital, and those are the ones who are dying in the ICU right now.
We have been joined by Evangela Brewster, who is, we all know, what is dear to our heart. And she had so many questions. I said, Evangela, why don't you just come on the show and talk to the doctor yourself? So I told her, now the only caveat I have, and Evangela knows this, that she has been listening and making notes about everything you have said up to now, and will not ask repeat questions. But okay, Evangela, hi, baby, how you doing?
Hey, Doc. Hi, Dr. Campbell. Hey, Mrs. Steph. Good to see you. What's up, man?
All right, baby, the floor is yours. You and the doc.
Thank you. Okay, so yeah, a lot of the questions that I had were answered. The last one that you answered, I kind of still feel a little weary about. It was about how many people have died due to getting the vaccine. And that's the one I feel like has been in my head and stuck with me, because I think now the question is, how do you determine if they died or not from the vaccine? Because I've heard a few stories where there has been, there was a 61-year-old mother who, I don't know all of the information. I just know some of it about the daughter and father who came forward and said that basically one day she was feeling good and she had just received the vaccine. And then a week later, she passed away, but she was healthy nonetheless before all of that. So I don't
So
know if
I need more information. So remember, if you just get the vaccine, I said a little bit earlier, is that, and you need to get two, right? You're not fully vaccinated until at least 2 weeks after you get your second dose, right? So that you can get the infection, right after you've been vaccinated, and you can still get sick from it, right? Right. So that you're not fully vaccinated until 2 weeks after the second dose. So it's a period of time to do that. So, but nobody has died from getting the vaccine as of right now, right? Because that would be something that would be all over the news if that happens, and that has not been reported, that nobody has died from getting the vaccine. Right? People have not, maybe not felt well after they got it, and we talked about that on the show here a little bit earlier. You cannot feel well after you get the vaccine, but nobody has died from the vaccine, and 613,000 people have died from getting COVID-19 infection. That's what I want people to hear.
Absolutely. Thank you. And then my other question is, for the people who are not going to get vaccinated, what do you recommend besides, like, I know wear the mask. What other things do you recommend as far as keeping your immune system boosted?
So tell me why they don't want to get vaccinated. Is it because they're scared, or they're still hesitant, or they're not, it's not available to them? Because it is easily, you can go to the Walgreens or CVS and get it anywhere now within 5 miles of your house.
Right. What if they're just not trusting of it? For me, I'm just not trusting of it. There's a lot of different things when it comes to just how doctors have been, me as a Black woman, not really trusting the field in that sense, and also the government. Certain things about that has swayed me, but other people, I'm not just talking about me, because I'm talking about me, but other people who are not going to get vaccinated and are, whether it's them being afraid, whether it's them feeling government situations, whether it's them feeling like doctors, they don't trust doctors.
Okay.
What would you recommend?
Well, first of all, a lot of people don't trust doctors because, what is happening. And in the African American community, we're talking about, obviously I'm Black, so, I understand the whole thing. People think about the withholding of treatment after Tuskegee experiment and all kinds of things like that. So there's a lot of mistrust, but I think the first thing is that there is no treatment for this infection if you do not get vaccinated, so that you put yourself at risk and your family at risk if you don't get it. So that I know that the message was really garbled at the very beginning about getting the word out about the safety, but this vaccine is very, very safe. I mean, I told you last time I was on, maybe before that I took the vaccine. I just had a sore arm. It was very minor. The things, I mean, I really didn't even think I had it. I've given it to people. I mean, and they've gotten through it safely, so that there is nothing you could do to make your body stronger, right, other than taking the vaccine. The vaccine, if you take the vaccine, the rest of it will work, right? So I know that there's mistrust with the government and this, and the way it was rolled out was terrible, but I think you have to think about the fact that this is the only treatment that works for it. All the other things, there was all this stuff about hydroxychloroquine and all this other stuff. They said you can take this and it will strengthen your immune system. You can work out, you can be in perfect shape. But I'm telling you that no matter how old or young you are, the virus will get you, and you don't want to have that happen, because there's plenty of people who are young. I mean, there's one of my former students actually has a catalog online of all the people who've died from COVID. His name was Dr. Cleavon Gilman. I trained him, and he was in the middle of the pandemic first in New York, and then he went to Arizona. Now he's I think he's in South Carolina now. But he's cataloging people young and old who died from it. People young, healthy, 20 years old, died from people, teenagers died from it, people older who died from it. So that I think understanding that the only defense against the virus is to take the vaccine, and there's nothing else you could do that will strengthen your body to do it. People taking all kinds of things to try to strengthen their immune system, but that stuff does not really work. And all the medicine, the hydrochloroquine, all that other stuff that the president, former president, was talking about when he was the president, that stuff does not work. The only thing that truly does work is the vaccine, and it is safe. And the message was garbled, and I know everybody's confused because of the masking thing. And you have to understand, this is a moving target, right? Because we just started doing this about 8 months ago, right? So in November, December, when it got approved, and we're still learning about about the effect of the vaccines on people, and now that it's down. But if you think about this, 325 million people have taken it. I mean, that's a lot of people, right? And the side effects have been fairly minimal. So I think you have to really think to yourself, okay, am I willing? You're going to gamble, right, with your life with this, right? So this may be, we were initially in a low transmission area in San Francisco, but now we're in a high to medium transmission. So that means the virus is here. And the Delta variant kind of changed it. I mean, about a month ago, the Delta variant was 1% of all the infections in the United States. Right now it's 83%, right? So it's 83%, right? So that means, but this changes things, and it's way more infectious, right? So it's not the same infection that it was before. And plus, we had been shut down and people weren't doing things and whatnot. Now things are relatively open and people are doing things. So the virus is spreading in the community. So I think you're going to have to trust the science, trust the fact that it's about getting you better and saving your life. I mean, I've seen a lot of people in my career, because as you know, I'm a trauma surgeon. I've seen a lot of people die, and it is not pretty seeing somebody die. And to have somebody, now the people who are dying from preventable deaths. That means that it can be prevented, and that's the last thing you want is have your family go through, is have you die from a death that is preventable if you just took the vaccine. So I respect the fact that you don't trust the government, because a lot of people don't, including me, right? But it's sort of something that this thing was based on science. As somebody who was a medical person and had been treating people for a long time, because I guess I'm an OG now, right? So it is. I've seen some terrible things happen to people, and I've seen a bunch of dead people who shouldn't be dead. And this is, we don't need that. We don't need any more dead people, because we got you got over 600,000 people dead. We don't need any more dead people.
There is something that you said that for me is really significant. You talked about the immune system, and there was a belief back at the beginning of the outbreak that you just need to strengthen your immune system. And there are some things that you can do to strengthen your immune system. You can eat this and see, and I am huge on that. I was very reluctant to take the vaccine, but I am big on eating the right stuff. And Evangeline has heard me talk about mushrooms, onions. There are so many things that strengthen the immune system. And then there is the C and the D and the zinc and all of the things, the quercetin. There's so many things that you can do that are really good for strengthening your immune system. Now, but you said it doesn't work. Now, so I'm still talking. So I see.
Well, it's okay to take that stuff, because I think, and you want to help your immune system. And that's
absolutely. I mean, and it's important to have a strong immune system.
That's right. I'm okay with that.
But my reflexologist who I see weekly. Okay. And she works on my immune system. My immune system is not good. And so she works to support my immune system. She says no sugar, because sugar will weaken your immune system. Green vegetables, more greens, no sugar. And she said, when are you going to get your shot? So I just need to say one more time. She said, do this, do this, do this. Don't do this, don't do this, and don't do this. Don't eat this. And then she said, when are you going to get your shot?
That's right.
So I just need to make sure you know. That's the reason why when she said, when are you going to get your shot? I made the appointment.
Yeah, we give people the shot when they come in the hospital now. You know,
Right.
That's part of their history now. Right. We give it to them because we think it's so important. I mean, you know, when I assume, you know, I was on call last night, you know, and when I go and I see somebody and they're sick, right, I don't ask them what their COVID status is. I check it, and a lot of times they're positive. So when I walk in a room, that means the virus. I've been in there with the virus a lot, right? And I try to protect myself as much as I can. I have multiple masks that I wear. I mean, I wear this is one of the masks. I wear this N95 mask. I wear a second mask. I wear face shields. I wear all kinds of stuff to try to protect myself so I don't have to inhale the virus. Even though the virus is in the room when I walk in there, right? Especially when you intubate somebody or you put a tube in, that's the virus spews everywhere. So you got millions of particles all over the room. So I just try to do as best I can to try to protect myself as everybody else who's in there who are taking care of the patient. We're doing things, but we're, you know, we take care of people the same way. No matter what you have, you know, we'll take care of you. And there are people I've taken care of where I've gotten really close to them. You know, people have been shot and I've taken care of them, and I noticed that they told me an hour later they had it. They asked me if I was exposed. I said, well, you know, I was close, but you know, I had 3 layers of protection between me and the virus, right? So that means that I didn't get exposed, right? So, right, if you get enough protection, you could do it. So, but the thing is, as it goes, it's growing in the community. The community spread is getting bigger now because of the Delta virus, and that's why they're going to start probably again with mask mandates in San Francisco and stuff. And they're already, you know, 500 restaurants and basically and bars have said that they want you to show that you have proof that you took the vaccine. Right. California has actually made it pretty easy now that if you take the vaccine, you can put it on your phone, and you can, it's a QR code that you have, and they could scan it and you could prove that you have the vaccine. So now
I went to the first family reunion in a while last week, and you had to have proof of vaccination to get into family reunion. And this was the bar. And, you know, and she's probably white. My sister was like, look, I love you, but you know, I love you, but, and I walked in with my card held high, you know, the whole thing. And you know, listening to Mrs. Still, and for me, I guess it depends on who you trust. I mean, for her, I know she trusts a reflexologist. She trusts Angie. And when Angie said, do it, I got it. And certainly I know all about the history of the United States government and Black folks, but I trust you. I trust you. Yeah, I trust you, right? And I mean, and I was on the other side. I mean, I tried to cut the 80-year-olds to get the vaccine. That's a joke. But my point is, as soon as Barack, everybody looking at me, as soon as Barack said it was cool. And so, you know, but what I don't trust is the virus. And for me, I just knew I wasn't playing Russian roulette with something that don't care about politics, skin color. Remember we first said, Black people can't get the virus.
That's what you said.
That's wrong, but
you told everybody.
And Idris Elba got the virus and said, oh, I guess that ain't true. Or maybe something in the melanin stops us. No. And I remember saying that, and the guy said, wait a minute, man, I'm an immunologist. You can't do that. But, you know, but the thing I didn't trust was the virus. So I guess on the thing maybe we could sort of wrap this up with, I put, can we beat this thing? You know, because I'm not sure, given the way all of it as people, and I'm not just people, there are people around the globe, right, are approaching this, can we beat it? Because people want to get back to normal. They want to live their lives. But if the path out of this, and I'm saying, if the path out of this is for every, is vaccination, can we beat this thing, or we're just gonna, and also knowing that this thing's gonna mutate and continue to be an issue, are we up to, I've always been skeptical about man for a lot of reasons. I've seen too many Planet of the Apes movies where it ended disaster in the end, right? Man, just like, oh man, they did it. I always figure they're gonna press the button, they're gonna do something hella stupid, and it's gonna be the apes and machines. That's a joke, but it ain't a joke for me. But I never thought it would be a health issue that would bring, because to me, the simplest thing to me that we always get would be health. And I'm sort of flabbergasted by this whole thing of how we can't outsmart the virus. And from your standpoint, can we beat it? And is vaccination, as we know now, the way to at least put up a strong defense again, and if not beat it?
Well, I think vaccination is the way out of this. So, but this is a global problem. And I think that the last numbers I've seen, 3% of people in Africa have been vaccinated.
Oh.
Right? And their whole countries, and well, Africa is a bunch of countries. But South America, the numbers are quite low. The Far East, same kind of thing. Even Japan. Japan is a very organized society, and we're watching the Olympics now, like everybody, right. And they've only had 15% of people vaccinated. You would think that they would have had a lot more than that, right? But and they have the highest numbers that they've ever had today and yesterday of people getting the virus. So it is a worldwide problem. What I'd like to see, and I think, because the way to get back to normal is for everybody to get vaccinated. The fact is, if everybody's vaccinated now, or we had 80 or 90% of vaccinated, we would actually be living fairly normally, because we thought that we had gotten through this already. And the numbers were really low. At the end of June, the numbers were low. We were happy. Everybody was talking about getting back to normal. And then here comes a Delta variant. The Delta variant now is rearing its head because people aren't listening, and people basically don't want to, they want to have enough of self-determination not to do it. They want to say, I don't feel like doing it because I don't think it's a good idea. And obviously there's a lot of reasons, and some are good, and then some are kind of like, okay, well, let's talk about this and see if you can understand this. So if we're going to get back to normal, right, we're going to have to vaccinate people. If you want to stay like this and watch people die, then don't get vaccinated, right? And that's okay. But this is going to become endemic, and we're going to deal with these out. So we're not even into the fall where people going inside on the East Coast, right? When people go on the outside of the East Coast, there's going to be, in the South, there's going to be a whole nother increase again. And we're going to go back to where we're at, and we're going to have huge numbers of people getting sick. Now, if you're vaccinated, you're not going to get sick, but it's going to become this thing called endemic, right? Where it's going to basically be with us like all the time, like the common cold or this, that, and the other thing. But this is going to be worse, right? And it's going to basically spread like wildfire through the population, right? So that's one scenario. The other scenario is we get vaccinated, we get through this, and everybody's happy, and we go back to normal, right? We don't have to worry about stuff. I went on a plane a couple of weeks ago, and I was totally petrified. I used to fly all the plane all over the place for work-related stuff, and I was totally petrified. I had a mask on, never didn't take it off. I didn't know who was. I know my family's vaccinated, but I didn't know anybody else was vaccinated. And then you can't. You walk in a place that says everybody vaccinated, and then we ask that question, and hopefully everybody's telling the truth. With your family, it's easy because you'd ask them and they tell you. But with people you don't know, with strangers, and how do you know that? So the thing I thought was kind of interesting. We're watching these super rich people, blasting off the planet and going into space and all that, spending millions of dollars, and billions of dollars. I'm like, you know what? Let me spend billions of dollars and inoculate the whole planet, right? So we've given 4 billion vaccines around the world, and we need to give more. So let's make a plan to have 10 billion people vaccinated by using money from governments, the World Health Organization, super rich people. Jeff Bezos is worth $200 billion, right? He can speak and give somebody $10 billion, and then all the rest of those rich guys can give $50 billion, and they can basically, go on a campaign to inoculate things. It could be like the eradication of smallpox, if you were getting skin lesions like they did after smallpox, you were dying a terrible death, right, from smallpox. Do you think that the smallpox was still here, right? Do you think that we would be having this conversation? Right. The problem is this thing is invisible, and but when you get sick, you get really sick, and you go in the hospital, and sometimes we can't help you. Most normal people go and get the infection, and they're in the hospital. They're basically saying now, because they've been interviewing people, saying, "Give me I'm sorry, I should have taken the vaccine," because you don't want to be in that situation. So making it so that we vaccinate the most number of people we can vaccinate, so we can get to that 70-80% number, so that there's no room for the virus to sort of go and do its thing. So I think, but it's going to have to be a worldwide effort to do this. And so far we've kind of fallen down on that because we're still fighting amongst ourselves over this political nonsense about stuff. If you have real concerns about, your physical health and concerns about that, or other things, that's one thing. But if you have a governor of Texas who says no mask, or a governor of Florida says no mask, I mean, if you go to school, if the kids go back to school, which they will, right, and they don't wear masks, then there's going to be a massive outbreak in the schools. And what is that going to do? You're going to have a bunch of sick kids, a bunch of sick adults, and then it's going to be terrible, right? It's going to, because this thing spreads like wildfire. Whole schools will be infected and shut down. And like, why are we going to do that for, right? Why don't we just do it the smart way? Vaccinate people who can be vaccinated. Everybody else wear masks. Try to do social distance we can. Improve the circulation in the schools. Do all that stuff and get these kids back to school. Because the other thing I worry, if the kids stay out of school another year, I mean, think about the number of kids who are already behind with their classes, right? And if they do that again, I mean, not everybody can learn by looking at Zoom, because doing Zoom is a hard thing to do. I mean,
Ooh, it ain't easy to teach on Zoom. Learn on Zoom. I got one last one for you, Doc. And this is, I'm telling you, people are listening and watching. Should my wife and I get vaccinated at the same time because of side effects?
I think the side effects to me were not that bad. I didn't have many side effects, but other people do. So if you're concerned about the effect that that your wife may have or your husband may have, then spread it out for a couple of days. Whoever's the more intrepid, partner, go first. I mean, women are clearly the strongest sex, so you should go first, right?
Oh, they are. Let's get that straight.
We're just guys with a bunch of wimps, we're kind of,
they are.
So we're weak, right? So, but whoever's a more intrepid spouse goes first and just sees how they do it. They're fine. I mean, I just had a sore arm for 2 days. That's all I had. I didn't have anything else. Other people felt weak and they had feverish and they headache. They had to go to bed and rest for a day or so. I mean, everybody has a slightly different response. And if you need to have a functioning household, which we all do, just spread it out and it'll be fine. Because it doesn't, a few days here and there is not a big deal.
Thank you, Dr. Campbell. Thank you for everything. You're just so passionate and medical about this whole thing, which is what a doctor should be. And again, we're up against it. And I love when you say it's an unseen opponent. It really is. Most opponents you can see in front of you, right? This one you can't. And it has an agenda of its own. And you're right. We've been talking about the United States and our own cities and our own neighborhoods and our own families. But you like to say, this is a worldwide thing. And unless we can figure this out, I feel the same way about climate change. Unless we can figure this out as a human population, as human beings, we're going to have a rough time with this. And it affects everything we do every day. I mean, going back to school, regulations you set up at work. The NFL is trying to figure out, what it should do with people who are not vaccinated. We got to. I hope we can rise to the occasion here. But you have. And I just want to thank you, Brian, a lot, man. I mean, really, you just, people can't believe you. I don't know who the hell ain't gonna believe it.
I've been doing this for a long time. I was thinking about this. I've been a doctor over 3 decades. So I've been doing this.
I know one that Malcolm, my son, he was skeptical. He said, well, I listen to Dr. Campbell. I said, I'm good. So just thank you for everything you do. Michelle, you may want to say something to him. Evangeline, you may want to say something to him. He's selfless and he gives of himself. I saw him yesterday morning you're probably gonna be interviewed tonight after you leave here, and I just hope you take care of yourself, brother, because we need you for sure. Any last thoughts?
We need you. We definitely need you, and I absolutely appreciate you. Thank you so much for your willingness, for your expertise, and for sharing. So thank you, thank you, thank you.
It's always great to see you guys, and I really am honored to come on the show and talk to you guys. It's really great. Thank you for inviting me. I appreciate it, because we have to reach everybody and talk to folks, and we may agree with things, and that's fine, but we got to make sure that we talk to folks and respect their opinions, because you gotta what we all want to do is get back to normal, right? And if we don't do certain things, we're not going to get back to normal, and we're going to be thrusted back in this situation. I mean, the cases are going up in LA, going up here. I mean, we want to stop this cycle again. We don't want to have another terrible thing where we have to close everything up and we end up staying home and doing all that. We don't want that. We want to get back to normal, because I think everybody's tired of this. I mean, everybody's like, I'm just over this, right?
The virus don't care if you're tired. The virus like, I'm gonna make you.
They're not over this. Don't do what we tell you to do, right? And we'll just live like this for as long as you want to live, right?
Yeah.
And
Ann, you want to say something to the doc before we let him go and get some rest and jump back into it tomorrow?
I just want to say thank you so much. Thank you, Dr. Campbell.
Thank you. I'm still hopeful that you're going to come around, girl. Always hopeful.
And on another note, the person who's been texting me say my wife's appointment is Tuesday. I'll be making mine soon. So.
Very good.
All right. Okay, y'all. Dr. Campbell, good night, everybody. We'll see you when we see you.
Thank you. Sorry about my technical problems, but I got it worked out.
Don't worry.
You're a saint, brother. Love you, man. Thank you.
Thank you, Dr. Campbell.
Guys, we hope to see you soon. Take care.
Alrighty.